Hey, good morning. I'm Senese with UroNurse News. Be sure to like and subscribe. Can focal therapy provide long-term cancer control without removing or radiating the entire prostate? A newly published study following patients for up to 10 years suggests the answer may be yes for carefully selected men. Let's take a closer look. Unlike surgery or radiation that treats the entire prostate gland, focal therapy targets only the cancerous portion, preserving as much healthy tissue as possible. Now, two of the most commonly used focal treatments include high-intensity focused ultrasound, or HIFU, or cryotherapy, which destroys cancer by freezing the tissue. The potential benefits include better preservation of urinary continence, better preservation of erectile function, faster recovery, and overall, it's a less invasive treatment. Now, researchers estimate that 50 to 70% of men diagnosed with localized prostate cancer may be candidates for focal therapy. Until now, however, long-term data has been limited. Researchers analyzed nearly 3,500 men with non-metastatic prostate cancer from two large prospective registries. Almost 2,900 received HIFU, while nearly 600 underwent cryotherapy. The median patient was 66 years old, with a PSA of 6.8, mostly intermediate risk disease, with approximately 1/4 considered high risk. Now, here's the headline. After 10 years, only 0.13% died from prostate cancer. Metastatic disease developed in only 3.3% of patients, and only 14% eventually required androgen deprivation therapy. Now, those are impressive long-term cancer control numbers for appropriately selected patients. Now, let's keep these findings in perspective. Focal therapy isn't necessarily a one-and-done treatment. About 1/3 of the patients required another focal ablation or conversion to surgery or radiation during follow-up. Approximately 30% eventually underwent radical treatment. Researchers emphasize this isn't a treatment failure. Instead, many men delayed or completely avoided more aggressive treatment while maintaining excellent cancer control. In a subgroup with at least 7 years of follow-up, there were no prostate cancer deaths, extremely low metastatic rates, and much lower rates of additional treatment. Study investigators concluded that up to 2 sessions of focal HIFU or cryotherapy may be considered as first-line treatment for carefully selected men with localized prostate cancer. An accompanying editorial described the study as the most mature long-term evidence supporting focal therapy. However, the authors also remind us that this is not a randomized clinical trial. Only a relatively small number of patients reached the full 10-year follow-up. Diagnostic techniques and focal therapy technology have improved substantially during the 20-year study period. So while these findings are very encouraging, more randomized clinical trials are needed. This study adds important evidence that focal therapy is becoming an increasingly legitimate option for carefully selected men with localized prostate cancer. Rather than asking whether focal therapy has a future, researchers now believe the focus should shift towards identifying the right patients, improving follow-up strategies, and delivering these treatments consistently across experienced centers. I'm Senese, and this has been UroNurse News. If you've enjoyed this evidence-based urology update, be sure to like and subscribe, and hey, share this video with your colleagues. Now, tomorrow on UroNurse News, FDA grants approval to Garzulis, a rapid-acting insulin biosimilar. A closer look at clinical use, prescribing considerations, and what healthcare professionals need to know as this new insulin biosimilar becomes available. Check it out.
UroNurse News every weekday at 9 a.m. Central Time, bringing you the news that shines. UroNurse News.